Welcome, Dr. Karishma. So let's begin our interview. Are you ready?
Yes, I'm ready, Lavanya. Thank you for inviting me.
So, can you introduce yourself?
Hi everyone, I'm Dr. Karishma. I'm a radiologist. I worked in Krishna Institute of Medical Sciences for my radiology degree, and I run a scanning center for the past 10 years, Sneha Scanning Center.
So, can you tell me the journey of your career?
So I was a regular average student, around 70% and all. I was never the 90% student. I used to play volleyball and I have played 8 nationals. So I got my medicine certificate through sports category. And then I was introduced to medicine. It was tough. After that, I got married and then I pursued my post graduation in radiology.
So, what is the difference between a radiologist and sonologist?
In India, it's the same. The sonographer in India, the radiologist does your scans. A person who does ultrasonography is called a sonologist. Whereas in foreign countries, in US and all, the radiologist just gives the diagnosis, whereas the sonologist scans the patient's abdomen.
So, what are the qualifications required to become a radiologist?
It is simple. MBBS is a mandatory degree. After that, depending on your rank, you have to select when you appear for competitive exams. Depending on the rank, radiology is usually the first few seats, and then you choose it.
So, what studies one has to do to become a radiologist?
Yeah, after your inter, after getting BPC, you need to do your MBBS degree. After that, you need to attend competitive exams. In that, you need to select your field.
So, do we have any further specialization like different types of radiologists?
Right now in India, it is not there, but in radiology, you can be a CT radiologist where CT cardiacs, where you can specialize in CT, or you can specialize in MRI, or you can choose and do biopsies or in musculoskeletal systems.
So, what devices do you use to do different tests?
Yeah, the major thing that we use is an ultrasound machine. This is the regular machine. It has multiple probes. Like multiple probes. Probes are, you can say, like multiple spoons. Different spoons for different cooking. Similarly, probes. So in these probes, some you use for a pregnant abdomen, some regular abdomens. When you use for your skin or your musculoskeletal system like shoulders or knee, you use a different probe.
So, can you explain the process of sonography in short?
Yeah, try to explain in a simple method. Sonography is sound, ultrasound. Normal sounds that we hear, which are visible to our ears, that is the normal frequency. Ultrasound is higher. This technology is used by bats. Bats are blind, they cannot see, and they wander in the night. So, what they use is they send ultrasound waves. The moment the waves come, they touch a surface and reflect back. This is picked up by the bat. It will measure the distance of that object, where it is, the depth of it, what kind of surface from the receiving signal of the sound. The same technology is used in an ultrasound machine.
It's fascinating. So, what are the emotions of the patients when they come during before the sonography?
Patients are usually very nervous and they are afraid. They don't know what they have. They want to be healthy. They're already in a lot of fear and panic. So, yeah.
So, What do you do when a person is feeling uncomfortable while you're doing sonography?
The most of them are usually adults. We reassure them. The easiest thing is we explain to them that it is not painful at all. It is like rubbing a cream over your skin. Once there is no pain, they usually cooperate.
So, what are the measures taken before and after sonography?
First is we request the patient not to move. We explain to them what it is. And then once we finish the scan, we usually while doing a scan we apply a jelly because sound waves do not travel air. If we have to send the sound waves into the patient's body, and there are no risks, there are no side effects to these sound waves. So once we send them to the patient's body, we need a medium that will allow the sound waves to go into the patient's body. That's why we use a gel. Gel is like a face cream, transparent. Once we apply, and then we'll be able to do the scan. Once the scan is done, we remove the gel and the patient is good to go.
So, do you have any idea who invented this technology like radiology?
No, I'm not sure.
Okay, that's good. Do you use AI for radiology?
Yes, AI is used in mammography, digital mammography, where the machine reads the data and picks up abnormal things, and then they are second read by the radiologist.
So, is MBBS really necessary for sonography?
Yes, yes. MBBS is the basic degree where it is must if you want to be a doctor of any kind.
Do you think a radiologist or a sonologist can be replaced by AI in future?
That's possibility, or it is very, very possible.
So, what are the risks you face in this profession?
The biggest risk that we face is our report. Our report is can be submitted in the court of law and we can be punished. Orally, you explain something to the patient, it's not that binding in the court of law. But once our report is issued, we can be penalized, we can be held responsible.
So, what is the importance of a radiologist?
Radiology has become the most important investigation right now. Previously, vaguely the doctors used to check how is the liver and other internal organs. But with the scan, anything, normal, abnormal, what it is, up to 80% of it can be diagnosed then and there.
So, do you agree that a minor mistake in the report by a radiologist can change the entire diagnosis of the patient?
Minor report, major mistake. Sometimes the reporting is based on other findings also. So we need to consider all the findings and then we will give a final diagnosis. Can we make mistakes? Yes, we are human. We do make mistakes.
Like you sometimes make mistakes.
Yes, yes. There is a human error in everything.
What levels of precautions do you take before submitting the report?
Before submitting the report, I personally used to type my own scans because that way I wouldn't depend on the technician who doesn't know the medical names or other things. So when I write my own report, when I type my own reports, that way I can eliminate the error of a typist.
So, what is an average income of a radiologist?
Average income depends on the center you're working. It depends whether you're in the periphery, you earn a little more in the periphery, whereas in the city, for a 6 hours job, they give you around 2.5 to 3 lakhs. And if you're experienced, they give you a bit more.
So, do you think an radiologist is a good career choice?
It depends if you are interested in the profession. But the biggest con, that is the drawback with the radiology, is You give excellent reports, you diagnose a rot, the doctor is happy, patient is happy, but you will not get the satisfaction of treating the patient. You will feel, I have given a good report, fine. I've picked up a good finding, I've picked up a subtle finding, good for me. But when you treat a patient and the patient goes healthy and the patient goes through a life-saving thing, the satisfaction you get there is higher than what you get here. This satisfaction is not in radiology. It's more of a technical job.
So, what advice would you like to give to the new radiologists which are joining? Yeah.
The first advice I would like to give is do your scan systematically. Don't see whichever parts are visible. Always maintain a method. Systematically, you need to check so that you don't miss out on anything. Second, and the most important thing is once you find out a pathology, you find a kidney stone, a gallbladder stone, don't be happy you've done the diagnosis. Complete your entire scan, because sometimes the patient may have 2 or 3 symptoms, unrelated things. So always make a list, go according to the list. The error rate will be very less, and there can be multiple problems in the same person. So always look for more pathologies.
So, can you just summarize the full discussion which we have discussed now?
Yeah. So the first thing is MBBS degree is necessary to be a radiologist. Radiology is more of a technical job and it can be taken over by AI. AI can also do the job, and it can happen in near future. There are errors, human errors definitely coming to radiology. And the biggest con is the satisfaction of treating a patient, where the patient thanks you for saving them, will not be there. Pay is a little high compared to other fields, and it is a in-demand subject. So if you have to follow the 2 advices which we have given, and if you are happy with it, you can continue as well taking radiology.
Thank you
Thank
for
you so
joining us
much.
in this interview, and we love the knowledge about radiology.
Thank you.
Thank you so much.
Thank you so much. Thank you.